Citygate County Corrections Gospel Mission. My name is Brenda Fryer, and this was my service learning project. The service learning project was chosen because of the positive impact Citygate Outreach Ministry has had on the community since 1973. The residents of the Christian volunteers work together to change the lives of residents and their families through core biblical values. The population served are the inmates of Chester County Prison and the criminal justice system, their families, homeless men, and the Bible-believing churches that volunteer to mentor the residents in the community. The needs of the homeless population are life skills, addiction counseling, education, literacy, job skills, spiritual guidance, stability, healthy lifestyles, and breaking the chain of family dysfunction to provide a positive future for this community. Objectives for Citygate Service Learning Project. By the end of the Service Learning Project, the student will cook, serve meals, and clean up kitchen per organization specifications. By the conclusion of this project, the student will complete blood pressure, blood sugar, and vision screenings on residents of Citygate Ministry that are willing to participate. By the end of the project, the student will teach residents basic knowledge on heart disease, diabetes, and other common health issues related to homelessness. By the end of the project, the student can identify 3 barriers to health care related to homeless disparities. By the end of the project, the student will be able to identify how Citygate Ministry provides the quality of life for the residents and the community it serves. Healthcare professionals' role in addressing the issues of the homeless population to show that we care. We have to put the puzzle together and address the issues. Those are social, political, economical, and cultural. Social issues. So, as the registered nurse, I provided a positive environment where the homeless feel they can trust me and develop a professional relationship by advocating and recommending ways to improve residents' health. At an all-day resource clinic in the medical tent, a man showed me a rash he had developed and appeared to be scabies. I educated him on steps to take to eliminate the infestation in his group home and directed him to nearby community clinics that could provide prescription medicine to kill the scabies. By teaching the significance of personal hygiene to keep bacteria from breeding and donating hygiene packets to the residents and community of the homeless, I was able to teach them proper hand hygiene before and after meals and after using bathroom facilities. I helped residents also write a simple resume to apply for career opportunities. Political interest. Teaching residents how to register to vote and what issues they feel need changed in the system to improve the community and in their families' lives. Introducing residents to state-funded programs to assist them in getting their general education diploma if they do not have one, and perhaps college enrollment, and how to find out where the closest ones are based on the bus routes and the schedules. Educate residents on federally mandated programs they may qualify for, like healthcare and nutrition programs, academics, applying for disability if unable to physically work due to mental health disabilities or other. Economics. How can we decrease the multiple disparities the homeless population have? Some do not know where to begin and are unfamiliar with resources available. At Citygate, I assisted during the resource clinic to help clients apply for copies of their birth certificates, social security cards, and identify skills they have to obtain employment through the Workforce Center. Families of the residents also attended the resource clinic and were given pamphlets and education on how to get food, clothing, health care, and even free cell phone programs to get the resources. The nurses' role in cultural issues. Language barriers were decreased by using translation apps for Spanish-speaking residents to communicate healthcare needs. The nurse understands that age related to important health screenings and helps clients to make appointments for physicals, colonoscopies, and etc. Ethnicity is respected by asking residents about traditions, religious beliefs, and cultural practices important to each individual. By showing this respect, trust, and integrity can be developed. As a volunteer nurse at Citygate, I ask ethnic-related questions to see how I can improve patients' dietary intake. An example of that would be to ask an African American man how often does he eat organ meat if his past medical history or labs show high cholesterol. Description of project design. The project is designed to provide residents and community with resources to teach life skills and a productive lifestyle, while providing home-cooked meals prepared by residents and volunteers from Christian churches. I made this happen by contacting the supervisor of Citygate and completing the volunteer prerequisites to participate in the outreach ministry. After receiving approval to volunteer, I signed a service learning agreement required for my Capstone Project. I implemented my project by purchasing and coordinating meals for residents, and the first Friday evening of every month, prepare and serve the meals to the residents and the homeless in the town of Coatesville, Pennsylvania. I helped coordinate an all-day event called a resource clinic to consider some of the priorities needed by this population and address the disparities they face for having basic needs met. As I continue to volunteer here, it would be helpful to the residents if I ask recommendations on healthcare topics of interest they would like to learn about. Resources at the all-day annual clinic event on April 29, 2017. We had a Bible station where we gave Bibles away free to anyone that needed them. We also had an eyeglass station where we donated reader glasses from a local pharmacy to all that needed, and they were able to size them, and we had mirrors there. We also had a clothing booth, and clothing for all sizes, male and female, and children clothing were given away to all. There was also a haircut and manicure tent where we gave free haircuts and manicures provided by professional volunteers. I also have my beautician license and was able to give a few haircuts while the other volunteers took a lunch break. I mainly was in the medical care tent. I provided blood pressure screenings, blood sugar checks, education on heart disease, diabetes, and nutrition. In the documents department, birth certificates, social security cards, and resume building resources for health insurances as well. How students successfully met the project objectives. Elements that are key to the success of the project. My church at Porters Grove Missionary Baptist Church in Conowingo, Maryland, we all donated and purchased the food and prepared the meals once a month to the residents and the homeless in the community. At the Resource Clinic event, we provided education, screenings for blood pressures, blood sugars, diabetes management, helped individuals complete resumes to get entry-level jobs. By interacting with residents and the homeless in the community, I was able to understand the disparities impacting their health care and their basic life skills. My project milestones analysis. So I provided healthy meals monthly. I addressed basic life skills needed. Also provided spiritual counseling and prayer. And resources for healthy lifestyles. Personal reflection on the impact of my service learning project at City Gate Ministries. On a personal level, this project has taught me many things about stereotyping the homeless population. You don't know someone until you walk a mile in their shoes, and just because they're homeless doesn't mean they did this to themselves or they're not unprecedented circumstances that have brought them to this homelessness. I did not realize the impact of how just preparing a home-cooked meal or being kind to another human can really change their life. They were so grateful and so appreciative of everything. The disparities the homeless face on a daily routine has opened my mind to the paraphrase, children learn what they live, and truly do not know what a healthy lifestyle is or goals to reach it. So it was a big learning curve and mind opening for me to see the needs of this homeless population and how I can impact them. Professional reflection on the impact of the service learning project. On a professional perspective, I was able to identify the multiple barriers the homeless and poverty-stricken populations face just trying to obtain basic hygiene needs and healthcare needs. I identified essential educational needs of the homeless and the significant medical concerns for the Coatesville having the second largest problem with sexually transmitted diseases in the state of Pennsylvania. And in the medical tent, when we gave out the hygiene packets that we volunteered and gathered from our church, we also gave out sexually transmitted disease packets, signs and symptoms, and what community programs that they could get help for. The homeless population does not want help maintaining the homeless population does want help maintaining their health, and they take it seriously as they do prefer healthy foods over processed foods and desserts. Citygate Ministries provides hope to the homeless. They're still looking for volunteers. Imagine if you've ever felt invisible before, like nobody cared about you when they turned their head and they didn't want to help you. How would that make you feel inside? I hope you enjoyed this presentation on Citygate Ministries and the homeless needs of their community.